This evening's event is one of those events that are organized by the medical team from New York that are here with us this week. This team is here as part of the Ministry of Health Visiting Specialist Program. We recognize there are a number of medical areas that we are unable to provide service for. And what we have done is to develop a system where we have persons who could come to Montserrat and share their expertise. This evening, I want you to join me in welcoming to Montserrat this evening Dr. Fergus Rowe, who is the lead person on the team. She will take over from me and introduce the team members to you so you have an appreciation of who they are. Dr.
Good evening, everyone. Thanks for coming out this afternoon. I'm sure there are a lot of other exciting things that you could be doing. So we really appreciate you coming out because we really want to share with you the reason why we're here, but also to tell a story, or the beginning of a story. In around November, fall of 2010, I received a call from Dr. Joe Daly and another call from Miss Lorraine Fenton, who was my math teacher at secondary school, and Colin Riley. And they had begun to begin to develop what would be the new program of specialists coming into the island to deliver care in certain areas of need, as you just heard Mr. Silcott elucidate. I had not been to Montserrat since the volcano. In fact, the last time I was in Montserrat was at the end of my medical school training in 1992, which was pre-volcano. So I remember visiting a very vibrant and beautiful island, which I was very proud of and continue to be. And so when I received that call that they were trying to initiate various specialists coming back to the island since so many people left after the volcano, I said, you know, I'm definitely in, and let me see what I can do to help. I mean, as a cardiologist, I know that the leading cause of death in the entire world, and even in developing countries, is diseases related to the heart, cardiovascular diseases. So I know that it was very important to begin to look into this area. At the same time, I was beginning a transition in my work. I was formerly the chief of cardiology at Harlem Hospital in New York, and I was transitioning to Mount Sinai Medical Center, also in New York, and it was the time that they wanted me to come was at the beginning, like 2 weeks after I started working at the hospital, and I was saying to myself, boy, I hope I don't get fired, but I really am going to go on this trip regardless. And so I began to think about how we should do this. So obviously, we know that cardiovascular disease is the leading cause of death, but I know what usually leads up to this in the United States, and I wasn't sure what circumstances may have been on the island of Montserrat to lead up to this. I have a very, very wonderful friend and colleague, Miss Gilda Caputo. Jill, please stand. And I reached out to her because we had just done a wonderful outreach program in Paterson, New Jersey, where we screened over 365 people. And Gilda will talk a little bit more about her work, but I reached out to her and I said, Jill, do you think you could come with me to Montserrat, because I'm going to be going down to provide care, but I really want to find out what's happening in terms of the risk factors for heart disease, which you're going to hear us talk about a little bit more. And without a hesitation, she said, I'm on it, and I'm going to be there. If you all remember, we also had another member of the team, Nancy Thomas. Nancy Thomas is a really wonderful lady who I met at Mount Sinai Medical Center, who is still trying to make her way here with the check for Montserrat. So she's still trying to come. But she is someone who's my right hand at Mount Sinai, and she does also participate in a lot of screening, and she said she would come. So Nancy and Gilda, along with my wonderful family, my husband Robert, and Ariane and RJ, who were somewhere in the audience, they gave up their vacation and we came here last year. And as you know, we did a wonderful outreach and screening, and we have a short DVD to show you about the experiences last year in a few seconds. This year, I decided to, a lot of people expressed a lot of interest in coming down to Montserrat and reaching out and providing care and screening, because everyone knows that heart disease is preventable, and with a little bit of input, you can have great output. I had the opportunity to meet one of my friends and mentees, Dr. Janice Scobie. Please stand. And we both started at Mount Sinai around the same time, and we've been working on a number of projects. And I said to her, Janice, do you think you would come down? Because one of the challenges I had last year was there was so much to do and so little resources. And one of the tests that you don't have on the island is echocardiography, which is so essential and so basic and so easy to do. And Janice has a specialty area in echocardiography. So she, again, quickly agreed to come down. And as you know, some of you who have received your echoes, she has been working very hard in the last couple of days to do echoes. I think she's already done over 30 echoes, right? More than 30, about 45. Yeah, so I think we should give her a hand for that, because that's really amazing. The other person, Dr. John Sumner, please stand up. John is the Director of Cardiology at Long Beach Medical Center in Long Island. I happened to come to know John through his sister, Dr. Ann Sumner, who works for the NIH, National Institutes of Health. And to tell you a very interesting story and how the world is so small, I met Dr. Sumner a couple of years ago working through the Association of Black Cardiologists. But last year, Dr. Sumner made a visit to Dubai, okay? Does anybody in here know what Dubai is? It's far away, okay? And who would expect to find a Montserratian in Dubai? But sure enough, they had an international conference, and she ran into and met Miss Agatha Aspen sitting over there from Dubai, and who started talking about the outreach that we did in Montserrat. So to make a long story short, I've been talking with Dr. Sumner along the months to follow about her coming to Montserrat. She said, you know, my brother would be very interested in coming along and helping. So that's how the team sort of came together, and we have been having an amazing time. So I want to again thank you all for coming out. Again, thanks to my family, thanks to God for bringing us here safely. We hope to really continue to serve and to work and to do whatever we can to improve cardiovascular disease states here in the island of Montserrat.